Hi Morgan, my name is Keegan. I'm a student nurse at St. Pete College, and I was wondering if you can give me an S-bar on your patient, Miss O'Connor.
Sure. Miss O'Connor, she's a 34-year-old African-American female. She came to the ER with a fever of unknown origin. So we are going to treat that. She has diabetes, so we're gonna monitor that. She was diagnosed when she was 8. A year ago, she started hemodialysis 3 days a week. She reported that her blood sugars have been kind of uncontrolled lately. She says that maybe the insulin isn't working for her, so we're gonna look into that and see what we can do for her. Her vitals are good. Her blood pressure is 138/78. Heart rate is 108, and her temp is 100.9. That can probably the tachycardic and increase in temperature can probably be due to some kind of infection she has. She has a history of chronic UTIs, so that might be the cause of her fever. So we're gonna be administering some antibiotics today. Other than that, she's a pretty healthy lady. She is alert and oriented ×4. Her husband's here with her today. He's really interested in helping getting her well and getting her out of the hospital. Let's see, her heart is good. She has said she's tachycardic, but she has a regular rate and rhythm. Not a rate, because her rate is 108, but her rhythm is good. She's got S1, S2 sounds. She denies any shortness of breath or any problems respiratory-wise. She did say that she gained about 10 pounds in the last few weeks, so we're going to look into that. Let's see, she's on a renal diet. We ordered some labs this morning, a urinalysis, a urine culture. We're still waiting to get that back. That'll tell us, if maybe the fever is due to a UTI again. And we have a CBC with differential due tomorrow. Neurologically, she's intact. She doesn't have any decrease in muscle strength, and
Okay, great. Well, you said that she's going to be receiving some medication today. Why is she receiving that, and what does it do?
So today she is going to be getting some Imponem with cystatin. It's a broad spectrum antibiotic, so it covers we can give it at the beginning to start treating an infection, because we're pretty sure that that's what it is, so it can treat a broad spectrum of infection, one that she might have.
Okay, great. And how does it do that?
So in the kidneys is where the Imponem is going to start working. The cystatin is kind of an additive. It helps not let the Imponem be metabolized, so it stays in there longer, and then the Imponem binds to a certain spot in the bacteria that inhibits the cell walls to grow fully. So without the cell walls growing all the way, they die before they reach their full potential.
Okay. And then why would you question administering this medicine?
Well, we want to make sure she gets her dialysis, because, like I said, her kidneys aren't working correctly. So if the Imponem stays in there a long time, it can cause nephrotoxicity. So we want to make sure that she's had dialysis within the last 48 hours, and then she's going to have it again in another 48 hours. That way we keep everything flowing through those tubules in her kidneys.
Okay. Does the medication have a therapeutic serum level?
That's a great question. I don't know the answer to that, but I can look it up for you. Give me just a second here. Let's see. The fun thing about the medication is when we give them, they have a availability for us to check it out. So just give me a second. I'll look it up for you. The therapeutic serum level for cystatin. What a great question.
I'm going to be your nurse today. This is Megan. She's a student nurse with me. I'm going to wash my hands. Can you tell me your name and your...
Why don't we get back to that? I'll look it up for you after. We're on a strict time frame here.
That's fine. What vital signs should be monitored, and what physiological parameters should be monitored?
Well, she's already tachycardic, so we want to make sure, she is diabetic, so her blood glucose is a big deal for us. So we want to monitor all vital signs all the time. Make sure the tachycardic doesn't get too high, or maybe she gets hypoglycemic where it gets too low, and she's sweating. We can tell that maybe her temperature is getting a little higher, and the antibiotic's not working, and the infection's getting worse, or her fever gets worse. We also want to monitor her fluid and electrolytes, her LFTs, her all things like that, things that kidneys do.
Okay.
Because kidneys are big for us.
What interventions should be taught to the client to ensure the medication is administered safely in the hospital and at home?
Well, she's not going to be taking this at home because it's an IV drug. So that's, when she goes home, we can tell her, infection, we have a fever, sweating, things like that. So obviously she was right to know to come to the ER with her infection in the first place. But with this, we want to make sure, since we're giving it in her IV, she doesn't develop any rash of any kind. That can, she could be allergic to it. We also want to make sure that it's working. So if her temperature is getting worse, we might need to, reevaluate the antibiotic we're giving. Yeah.
Okay,
And then, are there any side effects?
A lot of them have to do with like the CNS, her central nervous system. So she can develop seizures. She can become confused. Other than that, let's see. I have some other ones here. She can become hypotensive. The rash is a big one. One thing that we like that really can become a problem with people taking antibiotics is C. diff, because it obviously it's killing bacteria, but if it kills too much, and then we can have our GI system can be all screwed up from that, and then we can get C. diff from not the good C. diff that we like in our stomach, but the bad C. diff that comes out.
Gotcha. Okay, and last question. How do you know the medication is effective?
We know the medication is effective when, her temperature goes down. We see reduction of infection. So her temperature goes down, her white blood cell count goes down, general feeling better.
Okay. Okay.
Okay? No more questions?
No more questions.
Okay, maybe a little later. I'll still have to look up the therapeutic serum level for you. Okay, so have you ever hung an IV before?
I have not.
Okay, so let's go in and make sure that it's the right time. I'm gonna wash my hands. Hi, Miss O'Connor, how are you doing today?
Good, how are you?
Good, it's time for your antibiotic, because we're gonna treat you for maybe a UTI. That might be the problem. How was the dialysis? Was it okay?
Yeah, it's okay.
It was okay. You're feeling good?
Yeah.
Okay. We're on a renal diet here. Have you ordered any food for dinner yet? No? Do you know what a renal diet is? Okay. When I'm done hanging your medication, I'm going to teach you about the renal diet and why we have it. You want it. Is that okay?
Yeah, that's good.
Okay. I might consult nutrition too and have them come in and talk to you about it. Can you tell me your name and date of birth?
Shanae O'Connor.
Shanae O'Connor. Okay.
I'm 34.
I see you have some allergies here. Okay. Thopamine, ultra, I can't read that. Ultra thoraz. Okay, I see that. We have it marked in here, so that's good. I'm gonna step outside and grab your medications. I'll be right back, okay? Leave the room, and I'm gonna wash my hands one more time. So we're gonna do a series of med checks here whenever we do medications, right? So the first one we're gonna do, it's the correct time to give this drug. Great. And we want to make sure we have the right one. So the first ones we're going to give are the psilostatin, okay? So we have psilostatin here, right here. We want to correct the correct time, yes. The correct dosage, yes. The correct route, yes. The correct person, we check that with Shanae O'Connor. That's most important, name and date of birth. Okay, name, date, route, time, amount, beautiful. Okay, so this is right. And another interesting thing is that we need to make sure we're checking her fluids as well. So she's gonna get sodium chloride, just 0.9%. It's just a maintenance fluid, help keep her hydrated. So we have the sodium chloride, correct time. We're going to give it at 30 mils an hour. IV, dose, time. Okay? So we're gonna go into the room here. I'm gonna scan your wristband, okay?
Okay.
Okay, Shanana O'Connor. And then we're gonna do the impenicillin. Okay, we have the correct time, we have the correct dose, correct route, how long it's gonna go, and the rate that we're gonna administer at. Okay, so we're gonna do it at. Okay, hold it please. We have a little bit of a computer malfunction here. Now there's nothing on the screen. That's wonderful. Okay, here we go. I'm going to start over. No problem, no problem.
I'm gonna put my initials on this bag, initials on the time, and then also date, initials on my email. And my second, Maxim.
My computer seems to have been.
Maxim here, I'm gonna check my bag, expiration, the right time, what medication is given, the right routes for the amount, 100 milligrams per hour. Right medication and the right person. Shanana O'Connor. Yeah. So I'm going to.
Okay.
Find the other bag, so
So one thing I want to do when I'm documenting is I make sure that I look at her IV site and I assess it, make sure it's not infiltrated or anything. And before I do anything, I'm going to God, what is that called? Flush it. I'm going to flush her IV just to make sure the line is still patent, because I don't want to hang the bag, spike the bag and all that jazz, and then I go to flush it afterwards and the line is no good. Then I wasted all this medication and I have to wait for someone else to come and figure out the IVs. So we're gonna flush that beforehand before we do any of that. Okay, so I have one more here. I'm gonna do her
my secondary bag.
saline solution. You still Shanana O'Connor?
Input it in here.
Okay, you are good.
Secondary line.
Okay.
Imipenem. 500 milligrams and 100 milliliters.
I made a mistake and hit pause. You gotta stir it on.
Duration, 1 hour. Line. Now we're running on the secondary line. And I already initialed my bag.
So now we're all set. I'm going to head on over here. I'm going to bring my hand sanitizer with me because I don't have any over here. Okay. I'm going to take a look at your IV first, okay? Make sure it's not red. Does it hurt at all?
No.
No? Okay, good. How long have you had that one in? They put it in the ER?
Yes.
Beautiful. These gloves. Very small gloves. These are for midget hands. Okay, great. Wonderful. Okay, let me see that IV here. Let's see. Doesn't look red. It's nice, it's warm, it's not cool. First, before I even do that, I'm going to wipe off the hub of this for 15 seconds. Okay, good. So cap on that, wonderful. I always do that. Let's see, we're not clamped, that's good, okay. It looks like it's flowing nicely. Okay, now we can get started here. Shanana O'Connor, right? Okay. Good, we're gonna give these to you here. First thing I'm gonna need is this line here. Oh, lots of lines. Not this one, just this one.
Did you have any more questions for me? I do have a couple questions.
Okay, so I'm going to first not put this on the ground.
Can you tell me, was there any pertinent pieces of information that you reviewed before administering the medication?
Yes, we reviewed.
Are my clamps shut? That's very important. Guess what? They were.
And did this information affect your decision to administer the medication?
Yes, because he was allergic to any of the medications in order to tell that her vital signs were abnormal.
Did that information affect how you administered the medication? Okay, that's all I have.
All right, thank you. I'm going to go on and do some documentation if you'd like to follow along.
Yes, please.
All right, I'm going to wash my hands before I leave the room.
So today we're using this lovely Dial-A-Flow. It's wonderful. We want to set it to prime because that's what we're going to do first. We're going to prime our tubing. So then, here we go. We want to get all the bubbles out.
Yeah, I noticed that.
Ooh, lots of bubbles in there.
I didn't know how to tell you because you don't know that. Otherwise. Oh, yeah. Other than that. It was just, it's too perfect.
Okay.
We can
Couple more. There we go. Okay. Okay. So this one's all set up nice. We're gonna set this one to. Oh, did I close my clamp? I did. I closed my clamp. That's good. Oh. Okay. So here we're gonna set this one to 30. You want to see that I'm setting it to 30 mLs because that was what our MAR said. We're gonna set to 30 mLs the maintenance fluid. That's this right here. Okay. Then we're gonna do another one here. We're gonna do. I'm gonna come over here and I'm gonna double check again because we check at the bedside again. So we have our 500 milligrams in 100 mLs over 1 hour. Okay. prime this one too. We want to be really careful when we're priming these ones because we don't want to waste medication. So now we're good on this one. And we're gonna hook it to the secondary, which is right above. Here we go. Okay. So we're gonna reset our pump to 100 milliliters, and we want to run it over an hour. So 100 milliliters an hour. Okay. We are all primed and ready here. Okay. So before I do that, I'm going to put some gloves on, and we're going to make sure we clean one more time. It's okay. Just the end of the glove. Okay, let me see here. Okay, I'm ready to hook you up. Okay, now we want to make sure all of our clamps are open. We seem to be having some lovely drops going. You know what? This needs to be below that, and then we'll see what happens, right? Well, let's see. Everything is unclamped. We're unclamped, we're unclamped, we're unclamped. I just go a little bit lower. This is interesting. Let's make sure I put this on correctly. Maybe that could be the problem. See, because now it's going. This is fun. Oh, there it goes. It's just very slow. One. We want to stay here for 5 drops before we can say good. 2, 3. I'm going to go stand over by my computer. 3. Okay. Last thing I'm going to do is I have all these labels that I made up beforehand, and I'm going to make sure each line gets a label. They're good for 72 hours, so we want to make sure we're going to check them. Okay. Beautiful. Okay. So, Miss O'Connor, that's going to run for an hour. You said you ordered some food, right? So, I want to talk to you a little bit about your renal diet. The renal diet limits protein and phosphorus, and it helps not have a lot of waste from your GI, because your kidneys then have to work double time since they're already No, they're already a little sick, so we want to make sure we're sticking to that radio diet, okay?
Yeah, it hit the wall several times.
Okay.
But then it definitely.
Do you know what foods are low in protein? Can you tell me some?
Like, no,
No, you don't know any? Okay, so that's things like fruits and vegetables are good. You don't want to eat so many meats, like steak, probably a good thing to stay away from. No, bread is actually high in phosphorus, so we don't want to eat so much bread either. Okay? All right, so I did my documentation. I'm good to go.
I don't even know who did it.
I don't remember.
I don't know who did it. All right, if you guys can look.
Okay.
Thank you.
Do you have any further questions?
No.
Okay, good.